So now we know the complexities of this disease. We know the social determinants. We know social risks. We've heard about social needs. We've heard about collaboration to address some of these social needs. But now we got to think about that focus on the whole person, bring it all back together so that we can promote these long-term sustainable changes. So, excuse me, the solution we know is going to be very complex. It cannot be designed in isolation of other activities. Equity-based solutions require systems that address multiple levels of that socio-ecological model, involves diverse groups and entities, and promotes long-term sustainable change. Implementing population-level strategies that are culturally appropriate, evidence-based, and are shown to have the highest impact on reducing disparities within your patient population. So, this session we're going to talk about ways that we can increase the knowledge about these factors and how they can be implemented to address the chronic kidney disease management, particularly in racial ethnic populations, but also diverse populations. Remember the intersectionality that I mentioned before. We're going to talk about the importance of providing culturally appropriate whole person strategies as part of equity-based planning. How do you identify strategies that increase equity inclusion of the workforce so that it translates into better patient care? And then also develop a comprehensive plan that uses this health equity planning framework, and I really should have said lens, because this is the point where we're talking about applying the lens of health equity. Because remember, we have the terms. What is health equity? What is health disparities? What are health inequities? All of those terms. And then we went through and talked about the concepts related to programs, systems, policies, environments. Those are the concepts. And then the frameworks. How do you bring them all together? The socio-ecological model is a framework. The upstream, downstream factors, those present frameworks for us to be able to understand how these things get connected to each other. How do we develop this comprehensive plan that you can now champion and implement in your healthcare setting? So when we talk about developing these strategies, you want to make sure that you can outline a plan to address these complex issues. You may not decide to focus on everything at one time. So you may develop a stepwise plan where you implement small changes. Remember, success is a trail of small victories. So everything does not need to be done at one time. So when we think about this whole person, holistic care, we know that we need to take into account the mind and the consciousness of the patients, their health experiences, and their history, both their cultural history, their health history, their social history. Take into account their relationship experiences. For example, for the scenario that I mentioned earlier about the non-binary gender person, gender minority, otherwise known as, living in rural southern Georgia, they're going to face some discrimination, maybe in different ways. You see, there's overlapping social identities that become reinforced by discrimination and oppression. So all of these things come into play. And then just personal trauma, what they've had to deal with over the course of their lifetime. Just because it's not seen does not mean that it's not there. So how do we focus on the whole person, not just what we see and what they're being treated for in the clinic? So the goals of equity-based whole person care is to make sure that there is coordinated multidisciplinary treatment. That you provide these structured educational opportunities to promote self-management. So what are ways in which you can help them better understand why treatment is important for them, how to support themselves, not just the medication, but what are the other things that can be done? How can they get connected? It's one thing for you to say, I need you to go eat some healthy food, but it's another thing to say, here's a way to do it. How about we have a mobile van that comes here Tuesdays and Thursdays between these hours, and they bring in fresh fruit from the farm. So arranging so that you have the connection so that there may be discounts that are offered. I don't know what it may be. But treat the whole person. Have a workshop maybe that once a month where you have somebody who comes in and talks about mental health. Have different ways of connecting with your patients so that the only time they see you is not when they're sick. Have a shared decision-making process. If a patient is complaining about something that's not right for them or you receive some negative feedback, what do? Do you connect back with that patient and say, would you mind coming in and providing some ideas for how we can do things better? Maybe you have one night where you combine a dinner with the feedback. So let's talk about, what do you think we can do differently? Get their feedback, act upon that feedback. Build that relationship. And then primary and secondary prevention of these related complications. Because you know, the same risks that lead to kidney disease are the same risks that come out of kidney disease. So it becomes this cycle. So you don't want to have that cycle continue. And we're not just talking about the patient, we're talking about the patient and their family. What do you do when you have a family member who's had heart failure who's now having to be a caregiver of somebody who has chronic kidney disease? Reach in and reach out to them, because those complications can impact their ability to receive treatment from you and impact their ability to connect with you. So if you see on your dashboard, you've been doing your data, and you see that this patient hasn't come in the last 45 days or so, can you reach out? How will we have somebody who can connect with them to make sure that we don't have this 45 or whatever lag? So we're doing the best, but we're not doing it alone. We're working together. So some of these strategies, again, raising awareness about the risk factors, culturally appropriate patient and community education. Find out what your community needs.